an in-service that shows... Fuck. We decided to have an in-service to show how to care for these central lines, and also that we should be educating our patients on how to take care of their own central lines and how to advocate for themselves as well. First, let's review the pathogenesis of these types of infections. The first is that prior to insertion, the catheter can be already contaminated. The nurses and doctors placing these catheters are the ones that are managing this type of infection pathway. We, as nurses here, are intervening during the care of these catheters after they're placed.
Wait till you're looking at us to start talking.
I know. Our job is to prevent skin organisms from migrating from the catheter or from the skin surface into the catheter tip and colonizing there. First, let's review the pathogen. Did I already say that? Damn it. I'm terrible at this.
You're doing great.
Okay. Also, we must prevent contamination by direct contact with our hands, contaminated fluids, or other devices. Now, who can tell me the #1 way of preventing bloodstream infections?
Got this.
Tiana.
Oh, wash my hands.
Very good, Tiana. You hit the nail right on the head. The CDC has published guidelines, and hand hygiene is actually #1 on that list, so you got that right. Now, who can tell me what kind of precautions we're using when we take care of these patients?
Standard precautions and sterile technique.
Very good, Jolynn. Are you really going to be able to edit all this out?
Hopefully.
Wow.
I don't know. I just don't know how these things work.
I hope I can.
Pretty sure you can. You can usually just cut the video.
That's what I did on the other video. Cut it.
Also, we should be checking the integrity of the dressing and of the skin underneath the dressing every time that we come in contact with it. We're looking for redness, any exudate that may be coming out of the insertion site. So make sure that we're paying attention to that as well. Okay? Who can tell me when we should be changing these dressings?
I got this one too. Once a week.
Yes.
And whenever it gets loose or wet or anything like that.
Right, exactly. Now I'll go through the entire procedure of changing the dressing. We'll go through that step by step. The first thing that you want to do is
Wash your hands.
wash your hands. So after you wash your hands, we're going to actually put on just regular clean gloves so we can remove the dressing, the old dressing from the patient. Once we remove the dressing, we will wash our hands again, and then we will actually get our catheter kit or our dressing kit ready to go. Once we have done that, we're going to put on the sterile gloves that you will find in your kit.
You might find a dog.
This is Max, our therapy dog here at the hospital.
Yeah.
He's come to the in-service as well.
That's nice.
After we put on our sterile gloves, you will find that there will be CHG swabs inside the catheter kit. We'll use those to clean the catheter and then the skin around the catheter as well. We're going to let that dry for 2 minutes. And after that, we will be taking the CHG impregnated disc that you'll find in the kit as well, and we'll be putting that around the insertion site and around the catheter. After that, we will get the skin prep the area that we'll be sticking the stat lock on. We'll be adhering the stat lock, and then we'll be placing the clear transparent dressing on top of the stat lock. After this, we will be initialing date and time and putting that on top of the tegader. Lastly, and also one of the most important things we need to do is be removing the old caps from the catheter ends and the ports, and then we'll be scrubbing the hubs of those for 20 seconds vigorously, and then placing the alcohol impregnated caps back on where the ports are. Does anybody have any questions about that?
I'll go first. I'll show.
Oh, you're going to show us?
Yeah.
Thank you for volunteering,
Yeah.
Sienna.
Yeah, I know
Thank
what
you.
I'm doing, so.
Okay. All right. Well, let's see it in action.
All right, I will.
Okay, you can go. That's